The decision to have total hip replacement surgery typically comes when pain and disability from arthritis impairs your quality of life and daily activities. You may have tried non-operative treatments already, but currently are experiencing pain when putting on socks and shoes, sitting for long periods of time, walking, taking stairs, working, and sleeping. After you have the discussion with your family about getting a hip replacement, you will meet with your surgeon to set expectations about the surgery, recovery, and living with your new joint. Watch this video produced by the American Association of Hip and Knee Surgeons to see what you can expect on the day of surgery. You arrive at the hospital 2 hours prior to the start of your surgery. Once you're settled into the preoperative room, members of the orthopedic team take your temperature, pulse, respiration rate, blood pressure, and check your lungs. You may be given medication to prevent nausea, inflammation, and pain. Your surgeon asks you and your family if you have any changes to your health history or last-minute questions. The anesthesiologist discusses with you the risks and benefits of the types of anesthesia available and helps you select which is best for you. This patient opted for regional anesthesia that numbs from the waist down. Medication through the IV is given for sedation, which is a light sleep. General anesthesia is made available as a backup and can be administered during surgery if necessary. Once you're transferred to the operating room, the orthopedic team members apply an antiseptic to the skin of your leg to help prevent infection. Prior to starting the surgery, the surgeon confirms with the team the surgical side, proposed surgical procedure, and that antibiotics have been appropriately administered. Your surgeon will draw landmarks of your hip joint on your skin. The surgeon in this video uses the anterior approach, accessing the space between the front muscles of the hip joint. After the skin incision is made, deeper incisions are made using a cauterizing scalpel to minimize blood loss. Once the joint is exposed, your surgeon will prepare for implants. Retractors are used to keep the surgical site open and aid in moving around the inside of the hip. The surgeon separates the hip joint in order to access the thigh bone, the femur, and the hip socket, the acetabulum. A special surgical saw is used to cut the head of the arthritic femur away. It is carefully removed so as not to damage tissue. Cartilage called the labrum is removed. Your surgeon uses tools to remove only as much bone as will be replaced with the implants. The hip socket is shaped in preparation for a cup, where the artificial ball will sit. The tools are set with specific measurements that match your anatomy. Bone spurs caused by osteoarthritis are removed so the implants are placed on bone and not the spurs. Once the cup is placed, your surgeon may elect to drill through the holes of the cup and place screws that will secure the cup to the pelvis. Next, the surgeon prepares the femur. Trial implants are inserted to make sure an exact fit is achieved. Your surgeon may use X-rays to check positioning and fit of the implants. After checking and approving the motion of your leg, your surgeon will move on to inserting the final implants. The stem of the implant is inserted into your thigh bone. A surgical mallet and other tools are used to seat them firmly in place. The ball is placed on the stem. Your surgeon checks the motion of your new joint. A local anesthetic and medicine to prevent inflammation are injected into the joint. After the implants are in place, the inside of the joint is washed with sterile saline. The opening is sutured closed in several layers to create a watertight seal that helps with healing. A waterproof dressing is applied. You are transferred to a hospital bed and on to the recovery room. Most patients can expect to stay at least one night in the hospital after surgery, depending on your health and your surgeon's preferences. This is highly dependent on your physical condition before surgery, your age, and existing medical conditions. These may include restrictions, which are sometimes, but not always, given. for a library of materials written and reviewed just for patients by members of the American Association of Hip and Knee Surgeons, who are experts in the field of hip and knee arthroplasty. Learn about caring for your joints, alternative therapies, replacement surgery, living with your new joints, and more at www.aahks.org.